You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hi, everyone. We're back at Stellar Success Podcast. I'm your host, Dr. Tudor Francu, and I have the pleasure of having one of my colleagues here with me, anesthesiologist, Dr. Amar Setty. How are you?
Hi, we're doing well. Just getting ready for Thanksgiving. The season's really coming in strong here.
That's true.
Got a big trip coming up.
Well, Dr. Setty, we've been knowing each other for a while, and we've been through a bunch of stuff and business enterprises.
Yeah.
So I want to ask you to start with, what do you think success means for you?
Yeah. So, it's kind of an ephemeral question. It varies from person to person quite a bit. And I think one of the things that wisdom gives you is the answer to that question, which, I wish I'd known many years ago, which is really feeling fulfilled, feeling happy. Part of that is remuneration. Part of it is really the lasting legacy you can leave on the world. And I think that is how I've matured in my thinking about what the definition of success is and what I think it ultimately will be as I move forward. Because it's not just about money or making money. It's not just about helping individuals. It's about what you can do to leave your mark on the world, really, in some ways.
Yeah, that's true. A lot of people say that's the reason you're doing what you're doing. What's your reason? What is your why?
Right, exactly. So take what I'm working on currently. I'm with Patient Premier, CEO Patient Premier. And what we do is we try to translate subjective symptoms into objective data so that people could use it better. I'm sure most of the people listening have probably been in the situation where you're communicating with a physician and what you're saying just doesn't resonate. It's because these subjective symptoms we feel, particularly in pain medicine, where our focus is, are very hard to translate into that kind of objective data. We talk about that visual analog scale, the 1 to 10 scale with the smiley and frowny faces, and people go to their physician and say, "I'm in pain." It's a 10, right? Because they don't have better words to put it in, and physicians are limited in time. They have different ways of looking at it, and in many ways, our world as physicians is broken down into components of, can I code for it? What's the right code? What's the right thing to say in order to get that coding done? So what we do is we try to translate the patient experience into something that physicians can easily understand and use to improve patient care. And we make patients happier by making their voices heard. We make physicians happier by making those voices translated to information they can use readily and within their workflow, within a efficient amount of time, so that they can have face-to-face contact with a patient and not just sit there and transcribe information into a computer.
Nice. Yeah, that's a great idea. So you kind of branched out into the business world from the medical side, and I want to ask you to tell us a little bit of your story. How did you start?
Yeah.
What was your journey, and obviously, what are you doing now?
Yeah. So I started as a physician, went to medical school, University of North Carolina, did my training up here at Hopkins. In the process, it was all about understanding medical physiology, understanding disease, understanding my role as an anesthesiologist. And then you get into the real world, started practicing at Samaritan, and I've gone to multiple ambulatory centers, much like you, and worked through the years. I've also worked at a few hospitals, been up in New York, Pennsylvania, and now I'm at Greater Baltimore Medical Center in Baltimore, Maryland. And one of the great things you learn early in practice is, I don't know anything about the business of medicine. We're not taught that in residency. We're not taught that in medical school. And it's really a disservice that the industry does to us. They do a great job of teaching us medicine, pathophysiology, disease, how to treat an individual patient. But it comes down to, how do I make a living at this? How do I code properly so that I'm compliant? Meaning, compliance is a big thing. You and I know, but some of your listeners may not. That means that you are putting the diagnosis down, charging the right amount for that, so that the insurance company particularly government payers like Medicare and Medicaid, are charged the right amount and you collect the right amount. That process is incredibly difficult and convoluted. Any patient who gets those bills or not bills in the mail, and they see their EOBs and they look at them and go, where the hell did these numbers come from? It's equally confusing on the physician side. Maybe you can even comment on that. I'm sure you've been through that yourself, where you look at these things, the charges you make and the charges you look at. Right, but I'm sure you know what I'm talking about. I'm sure many of your listeners do. So that's one of the first things you learn, is that there's another world to medicine that just comes down to how do you properly, compliantly, and legally say what you did, charge for what you did, and collect for what you did. And it's very confusing. It can be a very convoluted environment, and that's where some of my start came in, is really just getting in practice and learning those basics, going to all those meetings, seeing what collections were, what the different metrics were, the things that I need to keep track of to know if I'm doing a good job, not just as a physician, but as a business person who's running a practice. As that evolved, some of my a friend of mine and I looked at that and said, you know what, we can go out and help other people understand this as well. So I worked as a consultant. My partner and I, we started a firm called Anesthesiologist, and we helped some hospitals, some practices do just that. Optimize their work, make sure that what their hard work and their good work was properly paid for, but they weren't overcharging, not overbilling, and that they were doing it in a legal manner. And this is something some of your listeners may not know, is that if you overbill the federal government, Medicare or Medicaid, if you engage in any kind of misbilling, even if it's an innocent mistake, it can be considered fraud, and it can be penalized at a very high level, and jail time is not unheard of in extreme cases. So these are not things you have to take lightly. You really have to understand it deep down. So that's how we got our start in business. It was basically a side business at that time, and I did that for a number of years. As I continued to work, I also worked as an advocate. I became the president of the Maryland Society of Anesthesia. In the process, I learned quite a bit about how pain is managed or mismanaged throughout Maryland. And I was talking to another friend of mine, a pain management doc at Hopkins. He's now moved down to Vanderbilt. We realized we are not doing a good job of seeing how patients are doing in their real life to really get a good idea of what their quality of life is. And isn't that what's really important, someone's quality of life? How are they living? When someone comes to me and talks to me about their pain, or any pain doctor, they're really looking to improve their ability to work, to be pain-free enough to talk to their family, to interact, maybe go on a long walk, maybe go on a trip with them. They're not just looking to improve 1 or 2 points on a visual analog scale. And that's where Pain Scored came in, the product we started developing. First, just like you might do in your garage, we hired a couple of contractors. We put a web application out. We asked our patients to start collecting data, fill out these assessments. We looked at the data, graphed it. We looked at different ways to visualize it. We saw, you know what? I can see some real trends here. I can see that my patient, who is constantly in severe pain, actually is not responding to the medication the way we thought they were in clinic. We need to try something different. Or we might see that they're actually having harm or an adverse effect. And this comes from looking at data over long periods of time, not just in those 10-minute clinic snapshots that we talk about.
I see. Well, let me focus a little bit on yourself more than your business or your profession.
Certainly.
So I want to kind of take a dive into your mindset of going into business side. And what do you think those skills or habits someone needs to have in order to be successful in that?
Yeah. So I like to break it down in terms of what are those characteristics that you need to understand about a business. And that can help guide your thoughts in how you might even enter into business yourself. The first is looking at your customers. What do they want? Is the product that you're creating actually something that they want? It may be something they want, but they may not pay for it. So whenever you enter, people have great ideas all the time, and they think, I should make a business out of it. And you can make a business or service or even a product that people like, but if they're not willing to pay for it, you're not going to have a successful business. So you have to have a good idea, and you have to have something people will pay for. That takes market research. So the first thing you have to do is really have the patience to go out there, take a good idea, and explore. Do research. It might be market research you use through high-level databases. It might be boots on the ground. You're going and knocking on doors. You're asking people questions. I don't mean your neighbors necessarily, though that could be part of it. I mean going to your potential future customers and seeing what that could be. At this point, you have to pause and say, all right, I get a great idea. I've got potential customers who will pay for it. Now I have to make a minimal viable product, something that I can put into the market and see, hey, not only did people say they would like it and they pay for it, but they actually will. So those are the first two steps. In these steps, you don't make any money. You're working for free. You're probably investing quite a bit of time and money into the process. So when you boil all that down, anytime you want to get into business of any kind, whether it's a startup or anything else, the first thing you have to do is be patient. Second, you have to do is have some resources, some sort of startup capital. And there are lots of different ways to get it if you don't have it. But perseverance, patience, drive. So personal qualities that go into it in the beginning. And then if you want to keep going with this, we can talk about, when you get beyond that startup phase, where do you go next? But that's kind of how I boil it down in the beginning.
Yeah. So did you have any kind of setbacks or failure that you learned from to go ahead? Can you give us an example?
Yeah. So one of the first things that we found, I'll go back to, when I first got into to business as a consultant, we had some initial very early quick success and did some consulting for some hospitals, a practice group, brought in some money, and we thought, let's just invest it. We'll put up some Google ads, we'll put up a nice web page and just see everyone coming in, right? But it wasn't that easy because in the time that we're talking about, the market had changed in anesthesia. In particular, at that time, small groups were getting gobbled up by larger groups, all financed by private equity. So at that time, the interest was not just in practice optimization. People felt their only interest in business at that time was to maximize the potential buyout value of their future company should a buyout offer come around. So then we had to rapidly pivot into looking at practice valuation, practice metrics. Are they efficient or inefficient? What is the value that they can bring to a buyer? And why would the buyer want these potential future employees to join them? So it was a real big pivot, and flexibility was part of that. But it took us a little bit of time to really make that pivot. And in that time, the market had changed quite a bit. So that is kind of an early issue that we faced, was you have to be willing and ready to see how the market's changing very quickly in order to meet those changes and optimize what you're doing as a business. Because if you don't do it, there'll be other people who are willing to do it for you.
So as a medical professional, do you have any strategies or intentions of developing any other passive income streams? Because you have the business aside from the medical practice right now.
Yeah.
What else are you looking at to create those revenue streams for later on in your life?
Yeah. There's everyone kind of has their interests when it comes to passive income, particularly in medicine. You find quite a number of people looking into real estate, both residential and commercial real estate, because you can generate quite a bit of passive income in the process. There is an upfront investment, but you hope that over time you not only pay off your investment, but you get returns that last you into retirement to give you passive income. And that's one great approach. It's not the one I've personally taken. I try to look to build businesses that can potentially grow to the point where they will return passive income to me just through being a shareholder. At the same time, though, I look to the market as a whole and look for growth and income to come through those marketplace investments. The S&P, the stock market, if you so want to put it, is at all-time highs right now. Both dividend-paying stocks and growth stocks are doing quite well. And there's multiple avenues you can use to get quite stable, quite predictable cash flows and income through the market itself. So as time goes on, as I get closer to retirement, I look to shift my resources from growth into value dividends, and income producing streams that will allow me to get that passive income to really allow me to retire in somewhere between 10 and 20 years, hopefully longer, but we'll see.
I see. So how is your day look like for a busy medical and business professional? What do you,
Yeah.
what do you prioritize? How is your day starting? How's your day ending?
Yeah. So when I'm clinical and I try to work 1 to 2 days a week, and that may be a weekend, it is I go to work and I'm doing my work at work and I'm not focusing on business. That gives my patients the attention that they need. So that's how that day works. I focus on patient care, one patient at a time, and I do the best job I possibly can for my patients. That is what I do on my clinical days. On my non-clinical days, I've stacked a series of meetings that might be development calls, sales calls, or other work-related activities. So it's a combination of meetings as well as fundraising meetings. One of the issues you have as an early-stage company is you're constantly trying to raise funds in the next round to fund the development that allows you to get to scale. We have a great, phenomenal MVP, or most valuable person MVP product, which means that we're in the marketplace. You can download and use our service. Physicians can use our service to collect reimbursement, and they contract with us and pay us a monthly fee. Great, it works. But we've identified 3 or 4 key things that we need to do to make it so any practice can use it, not just for 30 or 40 patients, but for hundreds or even thousands of patients. And that's where we're at a point where we want to raise money to improve our product and improve that process. So part of my day is actually getting on fundraising calls, honing my speech, honing what I say to investors so that they understand my business, who I am as a person, what the financials are of our business, and what their potential growth will be from the investment that they can make in my company. All of that has to be done in a very short period of time. Sometimes you only get 5 minutes from an investor, and that's time to present the company and answer questions. So you have to be very flexible in how you approach that.
If you would,
That gives you a pretty good idea of my days.
if you would go back to your beginnings with what you know right now, what kind of advice would you give yourself?
I always wonder about that. I think the first is obviously the time machine type questions. You go back and invest in Apple or Microsoft at the right time in the right place. But if we're just going back to give advice on how to be a better person right now, how to be better at business, how to react better, it really would be to, and this goes back to what I said earlier, to be more strategic and take bigger risks when you see trends developing in the marketplace, because they can pass you by if you're not fast enough and strong enough to market with those ideas. And maybe mean taking a bigger risk, maybe investing more of your time and money up front so that you can bring your idea to fruition. And so I would have pushed myself to get the ideas I have now to market much faster, because I think we could have been in a better place now as a business had we did a little bit more of a push 2 or 3 years ago when we were just getting started.
So what is your goal right now with the business you're having?
Yeah.
What do you want to take it?
So I kind of implied this earlier, and I might have to move locations if that's okay. Can you pause for a second?
All right. So we were talking about the business that you have going, what your goals and where do you want to take it?
Yeah. Oh, right. So as I was saying earlier, early in my career, I really focused on helping one patient at a time. And that's very rewarding. That's wonderful. But as time goes on, you realize that you want to have kind of a bigger mark that you want to leave. And one of the things I realized is medicine has so many areas where we can help improve the lives of not just 1 or 2 or 10 or 15 patients, but hundreds, maybe thousands of patients, improve their ability to access care, improve their ability to get care, to be advocates of their own care, understand their data, understand what works and doesn't work for them, and to be in a position to help their physicians and help themselves in the process. So if we can tackle those individual things that can really help many, many patients improve their quality of life, I think we'll have made a big mark on society. And just like I said earlier, with what I'm doing with Patient Premier, understanding data, using it to improve care for each individual patient as well as the population, is really something I will find very rewarding. So that's what I really hope to do with Patient Premier. I think that's what I think would be a great way to leave a mark on the world.
Great. That sounds like a great plan. How can somebody get in touch with you and learn more about your work?
Yeah, so the easiest way is to email me at amar@patientpremier.com, AMAR at PATIENTPREMIER.com. Look forward to getting any questions of any kind. And if I hopefully have had a little bit of advice to share that someone can take and use to energize their own journey.
Yeah, that was great. Thank you so much for being here. I hope everybody's going to reach out to you to learn more about business enterprises and how you can help them. Thank you very much.
Yeah, that's great. Hey, thanks.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.